The next technique I'll demonstrate is for lower back pain. So this is general lower back technique using the 5cm Grip It tape as well as the 10cm for additional support. You might vary using one technique or the other, or a combination of both. So we'll be using that over the lower back area. Okay, this time we're going to tape the lower back. So you just need your patient in a slightly flexed position through their lower spine. If they need support, obviously make sure that they're supported with their hands. It might even be propped onto their elbows. We need to measure from the base of their spine halfway up their trunk. Depending on how much support you want, you may extend that. And for this technique, we'll need 2 bits of tape. So I'm just going to measure this together. And then make sure you round the edges of the tape on each side. Okay, the tape then needs to be placed either side of the spine. So finding your centre. The first 5 centimetres of tape placed onto the skin with no stretch. And then the last 5 centimetres, no stretch. So applying along the skin with some stretch, and then the last part just placed on the skin. So this is following the line of the erector spinae muscles. And then we're going to do a similar line on the other side, nice and even with your first line of tape. Placing that down. And again, just rubbing the tape to make sure that the glue activates and sticks nicely to the skin. Now, depending on what the patient is experiencing and what you're trying to achieve, you might actually add a second part to this taping where you actually apply a 10 centimetre across the area of their pain, or you might actually only do the 10 centimetre across without these 2 strips. So I'll demonstrate both techniques there. So you're measuring right across the lower back. Again, rounding the corners of the tape. Folding the tape in half so that you can tear the centre. And then you have your 2 strips of backing paper free to hold onto and actually control the tape. So you can then allow a certain amount of stretch depending on how much support you're trying to achieve, and you can place that over the worst area of soreness. So we'll go into the lower back there. Placing that down with stretch, and then the last part, no stretch. There we go. And just have a stand for me just so we can show what the tape looks like, and turn around to face me.